First, I want to offer a preface to our team meeting. The allegory of Midway brings together many challenges. As Robert F. Kennedy suggested, we must dream things that never were and ask, why not? Working together on mutually beneficial goals involves co-building social, economic, and spiritual transformations for all our citizens. Working together offers opportunities to develop social and economic capital through mutual participation of those citizens. While there are no perfect responses to a crisis, the allegory framework allows us to dream options in solving complex problems. Offering safe spaces to discuss concerns and issues provides an energy to our brainstorming. That allows us to open doorways to different perspectives on the problems that are faced by all. This planning crucible garners the energy of the group to support relationship building and discover resources not previously examined. Using a solution-focused process unlocks energy that draws all participants forward. Using that same solution-focused approach keeps our eyes on the goal. Therefore, we seek to demonstrate possible options to organize and facilitate co-building community transformation by incorporating the input of all stakeholders, to include adding potential clients on the planning and evaluation teams. Now, let's begin our meeting. As the project manager, I was able to weave together the many strands of this project. When we began the community engagement, COVID-19 had not yet arrived in the United States, and we were able to work closely with the successful Veterans Suicide Prevention Program. They had developed an effective infrastructure of meeting locations in the area. Most veterans live less than 5 miles from the nearest location that offered a range of medical, mental health, and social support services. The CAT team explored ways to use the face-to-face infrastructures, and the veterans were most helpful in co-building the new programming and offering lessons learned from their successful efforts. We had originally slated program implementation for March. However, the spread of COVID-19 required reformatting the program startup and posed further concerns about mental health associated with COVID-19. Utilizing the existing physical infrastructure had to be postponed as originally planned, and the challenge of remote telehealth services required a new direction. Now, after reframing the program with regard to the delivery of services, we are about to launch the program again. Our colleague, Paula Lupton, LCSW, was in charge of administrative aspects of the program that didn't require as much reformatting, and her quality assurance expertise was a great asset in developing aspects of the CARE program. Ms. Lupton is not able to join us today. Dr. Jacinto will provide a brief overview of the program components to be implemented. Mr. Beggs, LCSW, will talk about some of the current concerns and possible gaps to address the program as implemented, focusing on 2 areas of concern: the Buffalo Ridge Reservation and the challenges involved with disseminating technology to residents of the area, to include training them to use online services, telehealth, telemental health, psychoeducational programming, and support groups, to include dialectical behavior therapy. Dr. Jacinto.
Thank you. As the CARE program is implemented, there are 2 sets of teams in place. First, the 21 members of the Community Action Team, or CAT team as we refer to it, that consists of 3 members from Midway, Paradise, Hope, Sunflower, Short Bluff, Buffalo Ridge, and rural areas. Next, the 21-member Evaluation and Assessment Team that is broken into 7 subgroups of 3 members include the following subgroups: suicide prevention and mental health programming, health programming and COVID management, provision of basic needs such as water, clothing, food, housing, electricity, communication technology, internet access, and smartphone provisions of technology, social and economic development, and search for grants and funding to address gaps in services. Also, family assistance. Next, the implementation this first year will include, first, improved emergency and follow-up care services. This includes local hospital, VA, and other health and mental health providers who offer micro, meso, and macro services via telehealth technology over the internet after the initial contact. Second, use of evidence-based treatment for suicidality and mental health. Dialectical behavior therapy for suicide prevention and mental health programming will be the primary method of treatment. Zero suicide and the Joint Commission protocols will also be included in this process, as well as a solution-focused program planning and evaluation approach. Additionally, CEs will be offered to therapists who have been working with the program and will continue to do so. Three, we will be working to equip primary care physicians to identify and support people in distress, also providing CEs for PCPs over the next couple of years. Fourth, to improve competency and competence of frontline workers to identify and deal with suicidal crises. Again, continuing education for training of frontline workers will be a part of that effort. Five, promote help-seeking mental health and resilience for all age groups, particularly within the schools in the area, both elementary, high school, and colleges. Six, training community to recognize and respond to suicidality. Community awareness training using Zoom and other technology, broadcast media, and presentations at civic, religious, and community organizations will be provided. Seven, to provide community with opportunities to manage the change. For instance, the macro care sustainability model, or roadmap as we call it, on which to weave the various training for the CAT team and citizens committees. Inclusion of Lifespan Australian Program's template as a holistic outline has been part of this process that we have weaved together. 8, to encourage safe and purposeful media reporting, development of awareness training for broadcast media. The main focus of this will be in the second year, although in the first year we will be interacting with the local media. And 9, improving personal safety and limit to harmful means of harming self. Safety vaults are one possibility. And 10, continued identification and invitation to team members and support people to join the care effort. Next, Mr. Beggs will talk about the various gaps that we are concerned with as things become implemented in the next few weeks.
Thank you very much, Dr. Jacinto. There are a range of concerns mentioned above here. However, two specific areas that will be monitored is connecting the Buffalo Ridge Reservation to the internet and future economic development for the tribe itself. The Tribal Council is currently in contact with an alternative energy company who is interested in locating a plant to construct wind turbines. This renewable wind energy technology fits with the tribe's values to protection of the land. They are negotiating with the company to have a training program so that 90% of the employees at the reservation will be tribal members. In addition, the company has agreed to provide renewable wind energy technology to electrify the reservation. The Tribal Council has also been able to work with federal and local partnerships ranging from corporations such as Dell to local schools and libraries to provide computers, tablets, smartphones, and most importantly, the internet connections needed to utilize those elements for the tribal members to be able to access telehealth, telemental health, psychoeducational programming, support groups, including that which Dr. Jacinto discussed earlier with the dialectical behavioral therapy. Additionally, the dissemination of technology instruments and tools will be made available to residents of Midway, Paradise, Hope, Sunflower, Short Bluff, and rural areas who need technology and training with existing technology to access the internet and services offered through the grant. Other elements that exist within the community, just as mentioned earlier, pairing with local libraries as well as local schools with individuals who are actually already trained to train others to promote that technology and to give the skills needed to those individuals so that they are able to access this. Lastly, the program may actually benefit from seeking partnership and endorsements from national organizations such as the American Academy of Suicide suicidology, and for instance, the Out of the Darkness Foundation, both with the benefit of additional media attention and also the benefit of improving interventions. Thank you.
Thank you, Mr. Beggs. Hiring the Director of Care of Midway and Promise County, there are currently 4 candidates who will be interviewed next week, and it is hoped that the new director will begin working within 3 weeks, and the consulting team will begin to transfer administrative duties to the Director of Care of Midway and Promise County. Now, as we conclude this overview of the program leading to the implementation starting in 2 weeks, are there additional thoughts members of the team would like to share?
Well, gentlemen, I have something. The head of the interviewing committee caught me in the hallway as we were coming in today, and I volunteered to attend the first interview, which is at 10 o'clock on Monday morning. If you folks could look at your schedules for the remainder of the week, he requested that one of us be present, and it did not necessarily need to be the same person. So I have some administrative duties to take care of with Ms. Lupton on Tuesday. If someone could pick up the Tuesday afternoon at 2, and I'll pass around the schedule for you. I am so impressed, and I'm sitting here thinking about where we began with just a concept and how much work you two have really put into forging the bonds of the people in the community, especially Mr. Biggs with you on the reservation. And I just almost got chills when I heard you talk about the WIN program there. Kudos to you. Good job. And Dr. Jacinto, your series of planning the program implementations and the concepts, I think those are going to be very impressive when we present to both the new director and the county commission in about 4 weeks. If you could just send me some times, I'll send you the schedules and we'll try to jockey between the 3 of us to ensure that we get all 4 candidates into an interview setting with at least one of us there. Then we'll pick up here at the end of the week on Friday at our usual time. Does that sound workable?
It sounds good, and I'm pretty sure I can attend that second meeting that you listed.
Great.
Thank you.
That's super. Thank you so much. And thank you both. I appreciate it. Until our next meeting, please take care.
Thank you.
Thank you.